Welcome to this educational video on biliary atresia, a rare and serious liver disease that affects newborns. In this video, we'll explore what biliary atresia is, its causes, how it affects the body, its diagnosis, treatment options, and what the future holds for those affected by this condition. Our goal is to provide a comprehensive understanding of biliary atresia for parents, caregivers, and anyone interested in learning more. The exact cause of biliary atresia remains unknown, making it a challenging disease to understand. However, it's believed to be a complex interplay of factors rather than a single cause. Researchers suspect possible roles for viral infections that the baby may have contracted either during pregnancy or shortly after birth. Genetic factors may also play a role, making some infants more susceptible. Additionally, problems with the developing biliary system during pregnancy are thought to be a possible contributor. It's important to emphasize that biliary atresia is not contagious and is not caused by anything the parents did or didn't do during pregnancy. Biliary atresia primarily affects the bile ducts, which are responsible for carrying bile from the liver to the gallbladder and small intestine. In infants with biliary atresia, these ducts become inflamed and obstructed shortly after birth. This obstruction prevents bile from flowing out of the liver, leading to a buildup of bile within the liver cells, causing liver damage and scarring. This process, known as cirrhosis, can eventually lead to liver failure if left untreated. The blockage of bile flow also prevents the body from properly digesting fats and absorbing fat-soluble vitamins. Biliary atresia is a relatively rare disease, affecting approximately 1 in every 10,000 to 15,000 live births worldwide. It occurs with similar frequency across different ethnic groups and geographic regions. While it can occur in both boys and girls, some studies suggest a slightly higher incidence in females. Due to its rarity, early recognition and prompt referral to specialized centers are crucial for optimal management. The signs and symptoms of biliary atresia usually appear within the first few weeks of life. The most common symptom is jaundice, a yellowing of the skin and whites of the eyes, which persists beyond the normal newborn period. Other signs include dark urine, pale or clay-colored stools, and an enlarged liver and spleen. As the disease progresses, infants may experience poor weight gain, irritability, and abdominal distension. Early recognition of these symptoms is crucial, so if you notice these signs in your newborn, consult a pediatrician immediately. Diagnosing biliary atresia requires a combination of clinical evaluation, blood tests, and imaging studies. Blood tests will assess liver function and look for elevated bilirubin levels, which are indicative of bile duct obstruction. An ultrasound of the abdomen can help visualize the liver and bile ducts, although it may not always be conclusive. A liver biopsy, in which a small sample of liver tissue is examined under a microscope, is often performed to confirm the diagnosis. In some cases, a surgical procedure called a cholangiogram may be necessary to directly visualize the bile ducts. While there aren't distinct subtypes of biliary atresia in the traditional sense, the extent of the bile duct obstruction can vary. Some infants may have complete obstruction of the extrahepatic bile ducts outside the liver, while others may have partial obstruction or involvement of the intrahepatic bile ducts within the liver. The specific anatomical configuration of the blocked bile ducts can influence the surgical approach and overall prognosis. The primary treatment for biliary atresia is a surgical procedure called the Kasai portoenterostomy, also known as the Kasai procedure. This involves removing the blocked bile ducts outside the liver and connecting the small intestine directly to the cut surface of the liver. This allows bile to drain directly from the liver into the intestine. The Kasai procedure is most effective when performed within the first 60 to 90 days of life. Even after a successful Kasai procedure, many children will eventually require a liver transplant due to progressive liver damage. Liver transplantation replaces the diseased liver with a healthy liver from a deceased or living donor. Supportive care, including nutritional support and medication to manage complications, is also an important aspect of treatment. Currently, there is no known way to prevent biliary atresia. Because the exact cause is unknown, preventive measures are difficult to establish. Research is ongoing to better understand the disease and potentially identify modifiable risk factors in the future. For now, awareness of the condition and early diagnosis remain the most crucial aspects of management. The prognosis for children with biliary atresia varies depending on several factors, including the age at which the Kasai procedure is performed and the extent of liver damage. A successful Kasai procedure can improve bile flow and delay the need for liver transplantation, allowing children to live healthier lives for a longer period. However, many children will eventually require a liver transplant. With advancements in transplantation techniques and immunosuppressive medications, the long-term survival rates after liver transplantation are improving. Recent research is focused on identifying the underlying causes of biliary atresia, developing new diagnostic tools, and exploring alternative therapies to prevent or delay the need for liver transplantation. Scientists are also investigating potential genetic markers and immune-based therapies to improve outcomes for children with this challenging condition. Continued research offers hope for improved treatments and a better future for children with biliary atresia.